The morale at the School of Medicine really has been great over the last few months. I've had an opportunity to meet with many of the faculty and the staff, a lot of the employees, students, and residents, and the morale is picking up, I would say.
Dr. Ghali, for folks who are just maybe they've never heard about this arrangement with the state and the University Health and the med school, can you describe in simple terms, because there's so much minutia, can you describe the relationship between BRF, the med school, University Health, and the state? In easy to understand English, I guess.
Or is that possible?
Is it possible? Yeah.
Yeah. Well, again, it's a rather complicated situation, but to try to get it down to the nuts and bolts, as you know, in 2013, early or late 2012, early 2013, then Governor Jindal mandated privatization of all of the state-run hospitals in the great state of Louisiana. The two here in North Louisiana, at E.A. Conway in Monroe and our LSU Medical Center in Shreveport, were two of those that were involved in this privatization process. The result of that negotiations early on resulted in the development of an agreement which is called the Corporate Endeavor Agreement. And that Corporate Endeavor Agreement is supposed to lay down in basic terms how the relationship between the hospital and the medical school is supposed to run. And that was established officially in early October of 2013, and that's what we've been. That's been what's been guiding both the hospital and the medical school since its inception.
That's when BRF came in to run the hospital.
Yes, ma'am.
Now, Erin and I, being in broadcasting, we are inundated with corporate consultants, and some of them some are helpful, and some just bug you to death. Is Biomedical Research Foundation, are they always looking over your shoulder? What is your relationship with them now that you're in the big chair?
Well, you know, I've been in Shreveport nearly 22 years now. At the Health Science Center, the medical school is what brought me to Shreveport. Actually, I was recruited here by John McDonald, who at the time, as you guys may remember, was the chairman of the surgery department at the school, and then ultimately became the chancellor of the Health Science Center. As a matter of fact, following Dr. Muslow, became the first official chancellor that we had here, because as you recall, we split off from New Orleans and had our own independent chancellor, and that's when Dr. McDonald took that position. So he recruited me here some 22 or so years ago, and so I'm well aware of the dynamics that goes on in this region here. The relationship that I say that we've had with the Biomedical Research Foundation, I'd be lying if I said it was completely hunky-dory all the time, but I don't know that anyone, any of the hospital partners around the state have a completely hunky-dory relationship with any of the school of medicines. It's just sort of a give-take. Each one is attempting to do what they feel is in the best interest for their stakeholders. The stakeholders for the School of Medicine is the faculty, the residents, the fellows, and the students.
The med school, there's been some talk, rumors, lots of, stuff being said about the med school's future in Shreveport could be in jeopardy. There's some lawmakers who think it should be moved to Baton Rouge. Address that. The governor addressed it with us here in town, and yesterday on the air said the med school is safe and secure. I want to hear your thoughts on that.
So my thoughts on that are that the governor and the president of LSU, King Alexander, have assured me 100% that the school is going to stay in Shreveport. It's not going to move anywhere. We're not going to allow it to move anywhere. It is absolutely safe and secure in Shreveport. I'm not worried about the school moving. I'm worried about it moving up in its academic standing around the region and around the country. That's my goal. So I am not concerned about the school moving. It ain't going anywhere except up.
I love to hear you say that, and I'm sure a lot of the employees and all the folks associated love to hear that as well.
Yeah, and I want people to quit. I want the legislators to quit saying that, because that is absolutely not true. I want the folks that continue to make these comments that are just, there is no push to move the medical school anywhere. I can tell you that the systems office at LSU wants it to be exactly where it is. And furthermore, the citizens of Louisiana, I mean, let me tell you, and I know you guys are aware of this, Ms. McCarty, but there are less than 150 medical schools in the entire United States of America. Mm-hmm. Our town, which, combined with Shreveport and our sister city over in Bossier, we have about 500,000 population. To have a school of medicine in a town that is fairly small is a wonderful thing. It's because of this school of medicine that myself and many other families move here. But why is it? Why do we have a school of medicine here? We have a school of medicine because the citizenry of this part of Louisiana demand to have a facility to take care of things like trauma, like cancer, stroke, and things like that. So, you could have a medical school here and not have all these fancy services that we have. Mm-hmm. And you would just need maybe half a dozen departments, and you could have a small school of medicine. But the people here demand and want for all citizens, regardless of their ability to afford the care or not,